At SCL Health, it's our mission to serve the poor and the vulnerable. That's part of why we provide free and low-cost health care to individuals who can't access that kind of care anyplace else. We serve tens of thousands of people in our safety net clinics across Colorado, Montana, and Kansas. It's really the heart of who we are.
Our healthcare system has a lot of gaps in this country. Sometimes the poor and vulnerable experience most of those gaps.
We often say zip code is more important than your DNA in determining your health. It's the social determinants of health, access to housing, access to transportation, and we have the opportunity to partner with them in the journey of overcoming these barriers.
The Caritas Clinic has been around for over 40 years. We provide comprehensive adult primary care services. It's a team of doctors that includes our employed and volunteer faculty along with a team of residents. We see folks anywhere from healthy adults to folks with multiple chronic illnesses.
I was working in the medical field for 5 years, and out of nowhere I just got sick and my whole life changed. No one knew what was wrong with me. By the time they figured it out, I had to be admitted right away. The medical issue that I had was called HLH. It was causing me a lot of rashes all over my body and a lot of itchiness, especially in my eyes. I lost my eyelashes, my eyebrows. I couldn't go home to my kids. My son was 1. By the time I went back home, he wouldn't recognize me. That was one of the biggest struggles that I had, that he forgot about me. I didn't want to come to the emergency room when I was sick because I didn't have insurance. If I didn't have care here, I wouldn't know where to get resources to get medical help.
The families without insurance or individuals without insurance are very much fighting for their lives. They don't have access to basic medications, screening protocols. If something goes wrong, they often will not be able to seek care out of fear for the cost. I met Maria actually in the hospital, and that's one of the great services that this clinic offers. If we identify patients who don't have insurance and would benefit from regular care in the hospital, we're able to follow them across the street here. Maria was presenting with a rare disease that young women can get sometimes. Thankfully, she's done quite well, and now is someone who's stable enough to be seen much less frequently. It's been a joy to meet her and take care of her.
Dr. Koppel, she was there since day one. She always made me feel that I was safe here, that she cared about my health. And she would always ask me everything to see if I was okay.
Access to care is vitally intertwined with the health of the community.
Across all our clinics, approximately 50,000 visits happen a year, and the vast majority of those patients are underserved, either uninsured or Medicaid patients.
My experience made me feel welcomed and that they care for my health, and I felt secure to be here.
We try to meet the needs of the patient, provide the care that they need, when they need it, where they need it, and provide a high-quality care.
I knew the doctors knew what they were doing, and I really appreciate it.